Morning.
We just want to let everyone and remind everyone that today's meeting is being recorded as we've just started. So if you don't want it to be shared publicly, please either share it personally during an email or maybe keep it for another time. Thank you.
Hi, everyone. Good morning and welcome to our Veterans Town Hall today. Thank you for arranging this. We thank both the Washington State Department of Veterans Affairs Office and the Governance Veterans Advisory Committee for inviting us today. I'm very pleased to be here, and I'm here with several staff members to help with providing information and answering questions. I'm Dr. Jill Reese, the Chief of Staff here at the Jonathan M. Wingright Memorial VA Medical Center, and I'm the acting director this week. Mr. Scott Kelter is our current acting medical center director.
Excuse me for a second. We have a number of people who have not muted their microphones. So unless you're speaking, please mute your microphones in courtesy to our presenters. Thank you very much.
And that might actually be, Linda, that might actually be your microphone too that's giving us a little background distortion.
Yes, so we have a little program, so I'll give the floor to Bob Wallace, who is the lead for this town hall. And then the next one will be Jim Sims, who's the chair for the Governor's Committee and Veterans Affairs. Thank you all.
Good morning, everyone. Please follow me in the pledge of our allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you.
Hello, my name is Jim Sims. I am the current chair of the Governor's Veterans Advisory Committee. I thank you very much for your participation. The purpose of these town halls is to provide information to veterans and their families on services and programs that are available, and to hear from veterans and their families issues so that we can pass that on to the governor. So thank you very much for your time and preparing for this. And Bob, it's all yours.
Thank you. Thanks, Jim. We'll go straight into our presentation. These individuals were selected to provide us with information that we hope will give you the information as well as how to access services for yourself, for a family member in charge of caring for the veteran, as well as other veterans you know in your community. With us today are representatives from Jonathan Wingright VA Medical Center, who will be covering community care and caregiving program. We also will hear from Walla Walla and Benton County regarding the Veterans Assistance Fund. I call on Linda Wondra to introduce representatives from Jonathan Wingright VA Hospital. Thank you.
Good morning and welcome, everybody. We're honored to be here as an invitation and would like to provide information for you all relating to COVID-19 vaccinations, what's going on right now with the VA, and also we were asked to provide information today about Office of Community Care, how the program works, and also about our caregiver support program. So I was going to introduce and Dr. Jill Reese, our Chief of Staff and Acting Director this week. I'm going to introduce her. We open up with some very brief information about COVID vaccinations. And later on, when we get done with our presentations, we will be answering any questions that you might have. So if you give me a moment, I will pull up the presentations that we have for you today. And then we can share that with you here on the screen. Hold on just a moment, please. So let me find the share screen. Here we go, everyone.
Lisa or Gary, can you make sure that they're able to share screen?
Go ahead. Looks like we're seeing your screen now.
You're seeing the screen. Okay, let me bring this up right here. Can you see that?
Yes.
You can see
Yes,
that. That's
we
good.
can.
Okay, all right, so here we go. So you can see the screen now?
Yes.
And we can see it.
Great, all right. So Dr. Reese, I'm going to turn this over to you, or Dr. Mason. I'm sorry, Dr. James Mason is going to be here, and he's going to go over some of the Moderna vaccination processes that we have going on right now here at the Walla Walla VA.
Thank you, Linda. And thank you all for those of you who are here listening. I hope this information is helpful to you. I think it's been pretty clear that the VA here in Walla Walla has cooperated very strongly with the national imperative to try and get as many people vaccinated, both to protect themselves and to stop the progression of the disease. The Walla Walla VA had the good fortune of Moderna vaccine, which was one of the newer RNA vaccines, and we've had a very successful program here with nothing much more than just the usual sore arms and stuff that we've had to deal with vaccines. The most recent news that has come up with the vaccines is the idea of boosters. And I think one of the things that I want to try and explain, because it's so confusing, is the difference between the third dose and the booster. The third dose, and I think one of the simplest ways to illustrate what that difference is just to point out with the third dose, people who qualify for the third dose could get it a month after they had their 2 series. Now, if somebody has a series of 2 shots or 1 shot, they can get the booster, the third dose in a month. And that dose is the same as the original dose and is intended for people whose immune system is severely impaired. And so this is a way to try and ensure that people, rather than taking 2, are able to take 3 doses to give them protection that they, because of their weak immune systems, might not have had otherwise. The booster, on the other hand, is a reaction to the fact that the shots, even when they're effective, don't last forever, okay? And so the limitation on booster shots is that those generally are not given until 6 months after you've had your vaccination, your original vaccination series, or 1 shot in the case of J&J. And the people that qualify for the booster at this point are anybody that's 65 years of age or older, or anybody who's 18 or older, and if they're have significant underlying medical conditions, number 1. Number 2, if they're living in a long-term care setting where they're exposed to a lot of people, or for people who work and live in high-risk settings. And that would obviously apply to those of us here who are working in a healthcare setting. We're exposed to people who are more likely to be sick. So people who are in high traffic public areas would also probably qualify for that as well. And so if you would like to get these vaccinations, what we have arranged is that, number one, contact your provider or your provider team to help you schedule that appointment. They should be involved in this. And if you don't have an assigned provider, you can call our main number, which is 509-525-5200, dial 2, and then dial 2 again, and then ask to be scheduled for a vaccination. So again, we're very committed to trying to protect the people that come to see us and our employees and the community. We participate in those programs as well. We're very committed to protecting people from what has been a very, very difficult period for the United States here with this pandemic. We're certainly wanting to do our part.
Okay, thank you for that, Dr. Mason. So we have two other really quick presentations that we would like to share. And the next one I would like to is if Melissa Stack, if you're online, please let us know that you're here, or Jesus.
We are both here. This is Melissa Stack.
Wonderful. So are you able to bring up your presentation for your community care?
I absolutely. Let me share my screen right here.
And everyone, this is Melissa Stack. She's a supervisory administrative support assistant in the Office of Community Care.
Can you see my screen?
Yes, we can.
Absolutely. Thank you all for joining us today. Real quickly here. So I'm going to go through very briefly how a, community care, Office of Community Care works. I wanted to show you a little outline of the areas that we serve in the 3 states here. We serve 16 counties, 3 states. The community care providers that are used through this program are credentialed under the CCN4 network by TriWest, or there are some providers that are credentialed under a veteran care agreement. These agreements are overseen directly through our payment center at the VA. So once an approved consult for care is received, our administrative staff will start working for you, the veterans, on that. And that comes about when either your PAC team, VA provider, or it could be a VA specialist submits a consult because they want you to receive some care that may not be available locally to you. Or if you have a VA funded community provider, so some of you may live rural areas and have a VA PCP, community care PCP, or specialist, they will submit a request for additional services. Once that request is received in our office, our clinical staff for OCC, they review the request to assure that it meets the guidelines set for the program. Those guidelines pretty much follow Medicare guidelines. And if that care, once it's approved, it's then forwarded to the Office of Community Care administrative staff. At that point, if the submitting provider did not ask you, the veteran, or the veteran that was there, for your preference in the community, we will reach out to you to obtain that. If the preferred provider is credentialed under the CCN network or a VCA contract, the referral is created and sent to that community provider. We do have to check, and I thought I had the slide in there. We do also check that the veteran is eligible to receive care in the community under the guidelines. Our staff, once we create and send that referral, our staff, they follow up with that community provider to make sure that referral was received. We try to find out how long it's going to take that office to review and accept the referral, and when would be their first time they could schedule. As a veteran, veteran family, veterans have the right to choose to schedule, self-schedule once everything is over there. And if you have made that choice, we'll send you a letter letting you know that provider has all of your information, has that referral, and you are free to call them to schedule. Most of the time, we actually place a call to you and send that letter. Or if you choose, you can have our staff get that appointment scheduled for you. Once an appointment is scheduled, our Office of Community Care staff will send the community provider the final authorization, which, and then they will send the veteran the appointing letter. So this will list everything that's covered. The appointment letter contains the validity dates, the standard episode of care. This lists everything covered under the authorization. It will also include information about prescriptions and durable medical equipment, how it is covered. After the first scheduled appointment takes place, we have staff then that make follow-up calls to that community provider to verify that you were able to get that appointment and to request those records. So at that point, if a veteran's community provider determines they need any additional care not covered under the standard episode of care, that provider will submit a request for additional services with the appropriate supporting records, and it goes back to the clinical team again. Little fact, just kind of wanted to share, in September 2021, our department received 3,250 consults, which were requests for care for veterans. Our staff scheduled 2879. Now that does not mean it was that amount we received in that month. And we would just like to thank everybody for your service. This is our phone number. Feel free to reach out to us.
Oh, God.
Well, thank you, Melissa. That was a great. We're going to move on to another really short presentation, and then we will open up for any questions that you might have. Chrissy, are you online, and can you share your screen and start your community, your caregiver program presentation?
Absolutely. Good morning. My name is Chrissy Kearns, and let me get the right screen over. I am the program coordinator for the General Caregiver Support Services, and I also want to thank you for your service. I appreciate a moment of your time. As part of the 2018 Mission Act, the Caregiver Support Program acknowledges the importance of family caregivers and collateral caregivers that are supporting our veterans. The mission of our program is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. And there are two parts of the umbrella of caregiver support services. And one part consists of the program of comprehensive assistance for family caregivers, and the other part is the general support services for caregivers. And this is providing a focus to improve the quality of life for caregivers so we can help veterans live to their fullest potential. And we accomplish that through helping folks navigate through the VA healthcare system, as well as accessing resources. And we provide training, education, and support to our caregivers, our VA staff, and our community partners. But as you can kind of see, one part of this program has to do with compensation to a stipend to family caregivers that are eligible. And it's called the PCAF program. It's comprehensive assistance for family caregivers who are eligible for veterans who have incurred or aggravated a serious injury in the line of duty. And that also includes a serious illness that is service connected. And so this program provides all the comprehensive supports, resources, education, a financial stipend that is a monthly stipend, health insurance if eligible, and beneficiary travel to caregivers of eligible veterans. So there are 7 points of eligibility for that side of the program, and I can talk a little bit on that. The criteria is to have a 70% or more service-connected disability, be in the need of personal care services requiring in-person personal care for a minimum of 6 continuous months. So these are an inability to form an ADL or activity of daily living or need supervision, protection, instruction. So this may range from someone who has incurred a traumatic brain injury in combat, or someone who has who has had a reduced functioning due to a prolonged disease state. And so the program is actually administered in a 90-day process by the side of our team, and we have our manager is Billy McCrum Denton, and so she oversees both sides of the program here at the Jonathan Wingright site. But this is a 90-day evaluations with evidence-based validated tool instruments, and we kind of send that toward to the regional seat, which is at the VISN level. And then that is reviewed through a pretty protocol and policy, and there are a couple appeals processes built into this process. It's kind of like a mini Social Security is what I kind of reckon it to, but and when the appeals, the final appeal, the third appeal actually goes to the national level and at the VA board. And I think there was a change in appeals, so it's now veteran directed and not necessarily VHA directed. But basically, if you're approved as a primary caregiver, you may receive a monthly stipend that's paid to the caregiver for the care they provide. And that's where we just really recognize, not just through the stipend, but in general, the contribution and personal sacrifices that people make to become in-home caregivers. It is very, they step back from work and other responsibilities, are sometimes in isolated situations with little support, and they're providing sometimes high level of care to our veterans. So this is recognizing those folks who are essential part of our health care team. They're essential part of the VA system. And but that getting those folks, if they're eligible for the medical benefits, counseling, travel, respite days, so that they can take care of their own health and needs. So this is a great program. And to apply for the program, you go through a process. There's a couple of different ways you can do it. And so it is through just caregiver.va.gov. And it will say the comprehensive side of the program. So that's the key word. So that is a pretty simply explained on that website, which is a really great website to reference the program and the details. You can also download it and mail it in to us here at this Jonathan Wainwright Mail Stop 202, so that we don't lose it into our and we will get that and get that process started and reach out to our veterans and our caregivers, because the veteran has to agree to participate. It can't just be the caregiver. The veteran has to give consent, and then we actually create a separate medical record for the caregiver, and we give them all the support we can. And you can also apply in person. If you just ask your PAC team for a consult to, you know, we can meet with you in person to discuss the program if that's your preference. And that is for the program of comprehensive assistant for family caregivers. And there's some recent changes. The program expanded the dates of who can participate, and that is all embedded on the website, the details of that if anyone's interested. And there are what we're calling legacy veteran reassessment. So there are some folks that were brought into the program a few years ago, and they're being reassessed. And the VA has there has been criteria change for the program and a reevaluation, and a lot of this stuff is done using, like I said, validated clinical instruments, but also like they stratified who and how these resources are going to be distributed. I think they've increased the actual distribution rates to almost over, I believe I read 300% more than the previous 2 years. So they're increasing the amount of benefits given out and also reevaluating who gets it and making sure they're appropriate. So some of our legacy veterans who received it, they would be reevaluated, and if they were deemed not appropriate at this point because they've made strides or have you know, are not needing the service, they would still get I believe 17 months of support so that their families can plan for, you know, the next part of where they're going to be at. Now the program that I am a coordinator of is the general caregiver support. And I don't have as many slides spelled out for this, but I would just tell you a little bit about it. It's the individual appointment with the veteran and caregiver. There's returns to clinic and follow-up, just helping navigate those VA resources, but also embedded in that, there are lots of offerings at a national level. Caregivers get to participate in like coaching and stress management, but also really disease-specific concerns so that they can get the education and support on handling specific situations. There's Annie-Text, Building Better Caregivers. Caregivers First is a local group that we run through that is really comprehensive. And then we have a series of offerings throughout the year and many more offerings. We actually got selected out of 2 sites in the VISN to participate in a pilot for caregiver coaching. And coaching is kind of the new model in the national, in a lot of the counseling and social work venue. It's the coaching folks, not counseling, but coaching. So there's a participatory relationship that we can do health and well-being of our caregivers so that they take care of themselves. And of course, November is National Caregiver Support Month. So we recognize all the caregivers. And here at the locally, we just went to the Yakima stand down and we're able to participate in, we were able to participate in that event. And that was great because we got to meet a lot of veterans, a lot of caregivers, and just provide support and some swag and different things. But there's also going to be a resource fair in November that's posted on, Linda did a beautiful job of a write-up on the main website for the Jonathan Wainwright website. And there's also a caregiver appreciation event. So we thank you all for your time.
Thank you very much, Chrissy. And that's all the presentations that we have. And Alfie or Lisa, is it okay for us to open up for questions at this moment?
Oh, Linda, on the chat box, there, the first question that came up was from Representative Graff. She is asking, are the VA veteran given full choice as to whether or not to get COVID-19 vaccines booster? If they do not get the vaccine booster, will they still be available to receive VA services?
Okay, I've got Dr. Mason here with me on this. And the question is whether if a veteran does not get a vaccine or a booster, are they still able to receive care at the VA? And I believe that answer is yes, right. There are no restrictions. A veteran may come and get care at the VA regardless of whether or not they have been vaccinated. They can get their vaccinations here, they can get them in the community. If they get their vaccinations in the community, we encourage them to bring their paperwork to the VA so that we can load that into their record. That should take care of that answer.
And then her follow-up question is, approximately how long does it typically take to get the veterans appointment scheduled for them to be seen? I believe this is community care question.
So is that community care or is that for vaccination appointment? Is there clarification on that?
Representative Graff, are you still with us? Let me see.
She is.
No, she had to leave.
Oh,
I would think that probably it's the appointments with community care. That's more critical.
Can you answer that question then?
Hi, everybody. At this time, it depends on the type of care. We are currently back in COVID phases, and a lot of offices are only scheduling 1 or 2 patients a month. So it really depends on the type of care. A lot of our providers' offices, their nurses are being called into the community care providers are being called in to help with the hospitals. We are facing the same COVID slowdown we had last year. So a lot of that, I wish I could give you a straight answer, but I can't. It just, at this time, we're pretty much back to where we were last year. So, I mean, some are quite quick. Some we can get veterans in, you know, seen the same week. Some we are really experiencing a lot of issues finding GI providers who are accepting pulmonology, because a lot of the nurses and the pulmonologists have been pulled back to hospitals. Elective surgeries are pretty rare right now. There's a lack of oxygen for doing these procedures. So there's a lot of things that affect that.
Okay, now I see a question. This will be for Chrissy. What is the average stipend amount?
That is something that is individually stratified, and I think there's 2 stipend levels. So it definitely gets over. It's, you know, I think that one of the stipends level is definitely over $1,000 a month, but it depends on certain factors, I think. So I would, yeah, I don't want to answer that because it's also changed since I've been in the program for a couple months. So it's also changed. So I think that if you're specifically interested, just look at the website, and also you can call our coordinators here and we can work with you individually on that. But it's a good question.
I can address some of that. Hi, my name's Raynetta. I am the PCAF coordinator. So I am the opposite side. Chrissy is my colleague in cohort. So I work the stipend side of the program, and the PCAF and stuff is set up a lot differently. So Chrissy is correct. The amount and stuff is going to vary. So there are a lot of factors that are going to come in. So it's dependent on the location of the veteran. It is going to be determined on whether or not SEAT, who is our centralized eligibility appeals team, what they determine the level of care is needed for the veteran. So with all that kind of factored in, it kind of goes up and down as far as how much they will get. So I'm going to give you an example. So we don't have an average, but if in Walla Walla at the 99362 zip code, if somebody comes in as a tier 1, the payment and stuff is going to be approximately $612 a month. Tier 3 is going to be at the 2451.66. So again, it depends on how much care they needed. It has changed and stuff. We used to have 3 tiers. It is now 2 tiers. So it's kind of split. The first level, they're called levels now. Level 1 is looking at the veteran needing approximately 62.5% care needs. So again, the money and stuff, depending on the location, is going to be a lot different.
So the other one, to follow that question, it says, what is the date of this? When was this effective, the community care program? I understand it does not include Vietnam veterans because of the date it was effective. Is that true or false?
No, that has changed with legacy, with the change of the Mission Act. So the dates and stuff now have moved a little bit. Before the Mission Act, it was post 9/11. I'm going to share my screen here with you and share. So the dates and stuff now, can everyone see my screen?
We can, yes.
Okay, so right now in things, this is where we're looking. So it's anybody and stuff that has had an injury prior to May 7th, 1975, or on and after September 11th, 2001. So these are our dates. So anybody between 75 to 2001 is not considered for this program. Did that answer everyone's question?
Thank you for that, Raynetta. Are there any other questions from the group here that they would like to present to our group here?
Yes, I put it in the chat and I think Lisa re-shared it. Regarding community care, what about the offices in the community care network that were authorized, but for some reason, due to either a loss of paperwork or a switch of systems, are no longer quote unquote authorized, although the veteran is still going to see them in the community or wants to go see them in the community, and they should be authorized, but they're not in the community care network anymore. How do we reconcile that? And how long is it going to take them to get back on the list?
Hi, can you hear me okay? This is Jesus Robansky.
Yeah.
So Tri-West takes care of our credentialing. Since they've gone to CCN network, they've tried to kind of parallel and make sure they get all of the providers that were previously in network. There could be a lot of different reasons. Like you said, the paperwork could have been lost. You know, it could have been that they were waiting for more information. But that is something that they can take care of. If there are specific ones that you're seeing that are not credentialed, I could definitely look into specific ones. For the most part, it's been taking them a little bit longer than we would like. Between 3 to 6 months is usually how long it takes them, because they have to do the background checks, right? I mean, they're having to kind of do the whole process all over again, being in the new system. But it shouldn't say that they shouldn't be able to eventually get in network. But to have specific ones, I would be able to look at them for you in general. But they are working on trying to beef up our providers in our network, and they've done a really good job, mind you. Most providers are available. And then veterans, if they want to see a specific provider that's not at network, we have TriWest go and kind of find out if they can get them in network, right? And then do their process. But they are the ones that do all the credentialing and the reaching out and all the good stuff. And we can just follow up. We do have access into their portal to see where they might be in the process. But usually when they're kind of right in the middle of all the paperwork, that's kind of when you can't really give a date, but you can at least know that it is in process and it'll eventually be done. But like I said, for specific NPIs, they can give me those specific providers. Otherwise, it's kind of, we just know when it starts, and we know it usually ends about 6 months later.
Okay, thank you. Yeah, I private messaged you my email if you can get in touch with me about that. I do have one specific provider, and
absolutely
that I'd like to talk to you about.
Absolutely, yes, yeah, we'll do. Thank you.
Thank you.
Thank you, Jesusa. Any other questions that we can answer for you today?
This is Bob Wallace. Can we go back to the date of the date of when a veteran is eligible? Am I correct? It was 1975 through 2001. Am I correct?
So I'm going to pull that screen up again for you. So
Okay.
it's for individuals that are on or before May 7th, 1975, or on and after September 11th, 2001. So example would be, I joined in 81 and I got out in 93. So I would be excluded from this program. So it's prior to 1975 and after September 2001.
All right. Thank you very much. Appreciate it.
Mm-hmm.
So I understand that question. Let's say a veteran is 70% service connected, and like he can no longer take care of himself or herself. And so if they are in between the time frame 75 and 2001, they are not eligible. Am I getting that?
Correct.
Okay.
Correct. And what I sometimes have to remind the veterans and the caregivers during the application process is that it has to be service-connected disability. So, and it's at 70% now. So the unfortunate part is when they initially come in for the application, if they don't meet the specific criteria that has been set up nationally, I deny them at that time, and I explain to them the reasons why they haven't met the basic criteria for the program. However, if, let's say, as we're moving through the process, something happens and it goes to SEAT. So SEAT is our centralized eligibility appeals team, and they are the ones and stuff that make that determination of whether or not they are going to be approved for the program or they're going to be denied for the program. So we don't make that determination.
And it's important to remember also that on the general side of the program, that's open to everyone. That's open to any caregiver, and we can still get you eligible for hero miles, for respite days, for lots of groups and resources and individual support sessions. So everyone is eligible for that. And you just have to either put a consult in with your PACT care provider or apply online or give us a call.
Yes, and the distinct separation between the two is that Chrissy's program does everything that our program can do. The difference is going to be PCAF is an application process. Hers doesn't require an application process, and the PCAF is stipend, and hers is not. So that's probably the biggest difference. Would you agree, Chrissy?
Great, thank you for that. Any other questions on community care, on the caregiver program, COVID-19 vaccinations, anything else for the VA?
Alfie has a question.
I do. So a lot of people think that caregiver in many instances is the spouse. And I just want to make sure that that we really get that definition, well explained, because a spouse may not be in a position to be the caregiver, especially, depending on age. So can you please elaborate on that the meaning of what caregiver means and who may be able to get the stipend?
Yes, ma'am. So for the stipend, the individual, again, according to our national guidance, is if they have to be a family caregiver. If they are not a family caregiver, they have to live full time with the veteran.
Okay.
So I think it's pretty, you can have friends that are actually helping and they reside and live with the veteran and they're not a family caregiver or they're not a family member.
So the other question, can you explain how eye care is handled? So I don't know if somebody can answer.
Are you talking about getting eye care at the VA? And whether it's they get the care here at the VA or through community care?
Mr. Davidson, are you still with us? Can you elaborate more on your question? He said both.
Said both. Dr. Mason, can you take that question in relating to eye care, eligibility for eye care?
Optometry is pretty.
We are having issues with your sound there, Linda. Well, Linda gets that fixed. Looks like Alfie, you have your hand up. Go ahead, Alfie.
No, I'm sorry, I forgot to take it down. Apologies.
So I don't know if I just got recently referred to community care for my eye care. So I don't know if that's the same way on your side. I guess the eye clinic at American Lake, they had called me and then they told me that we are authorizing you to go to this facility to get your eye exam done. And then their instruction to me is once it's done, then bring your prescription to that clinic, which I have done. And they ordered my glasses and then my glasses came in the mail. That's how, the Puget Sound VA does their eye exam and stuff. So I don't know if the practice is the same way on the east side of the mountain.
Okay, so apologies, somehow our screen blanked out. Dr. Mason is here to address the optometry question.
And it doesn't come directly through my department, but that is one of the departments we have. And there, I apologize, so I don't have a number for them, but my understanding is that veterans can get their eye care directly by communicating with our optometry clinic. If you call the central number, I'm sure they could direct you to the optometry clinic, and they would be able to tell you what your options are based on your situation.
And Mr. Davidson, if you need additional information, you can reach out to us. I can give you my phone number for anybody who has questions to call, and I can certainly pass that information on or help you get information. My phone number is 509-386-1117. That's my VA cell phone number. So you can write it down, and if anybody has questions, they need clarification on anything, I'm happy to take the call and get you some answers. Are there any other questions for the VA? I don't want to take up all the time. I think we have other presenters. If not, you can also call me and I will help you with anything that you have concerns or need additional information. And just real quick, if you want to write this down relating to the optometry direct connect number, if you have questions about eye care, you can call 509-527-3491, or you can call the main number and just have the operator transfer you. Any other questions?
Linda, they can also call the OCC phone number if they have questions of any community care optometry consults or how that works as well.
Okay, great. You want to give that number out again, Jesusa?
I will put it in the chat for you.
Perfect.
Thank you.
Yeah, everybody be looking for the number in the chat. And thank you, Alfie. We were glad to be here.
So much, Linda. Truly and greatly appreciated. So as Linda said, she provided her number. So if you happen to lost it or something, you can also email me or call me and I will put my information on the chat box.
We've heard a lot from the VA hospital. Let's find out what the counties have, what can they do to help veterans? Let's start with Benton County first. Benton County, are you there?
I'm here.
Go ahead.
Well, first of all, I want to say thank you for your service. And I want to really emphasize on what Benton County has done, especially during COVID for some of our veterans. Last year, our commissioners approved an extra $1,000 stipend for each family, for each veteran that has applied for the Veterans Relief Fund. And they were able to use it for rent, utilities, food voucher, gas vouchers. Both Benton and Franklin County veterans can apply for the Veterans Assistance Fund. They can come in to Department of Human Services or go to some of our local veteran centers and apply for the fund. The veteran can schedule an appointment. Some of these veterans don't have the ability to come to our office. So we make a point of if going out to the veteran if they are not able to come in. All the county needs is a copy of the DD 214, proof of current residency. We want to make sure that they get the right amount. So if the veteran is married or still has dependent children, we ask for a marriage certificate. We ask for birth certificates for the kids. We want to make sure that if widows or widowers are eligible, we want to get them also the right amount of monies that they qualify for. The relief fund will pay for utilities. It'll provide rental assistance. We can provide up to a week of motel for homeless veterans, bus passes, food vouchers. We provide $1,000 once in a lifetime burial expense, up to $2,000 in dental assistance. That's also once in a lifetime. And then we can pay for necessary safety equipment for employers. We've paid for licenses for Washington State Department of Licensing. So if it's going to help them gain full-time employment, then we'll definitely use the relief fund to help them pay for that stuff. One of the things that we've made a point, because the Veterans Assistance Fund is handled by the county CES or Housing Resource Center. When the veteran runs out of funds in the relief fund, then we make a point of assisting the veteran with any local, state, or federal funds that our housing programs have. We got treasury funding for anybody that had been affected by COVID. So we made it a point to make sure that our veterans had access to that fund. We can pay up to 18 months of rent. And it can be back rent. Let's say that the veteran is behind 5 months. Then we pay all of their back rent plus an additional 3 months of rent. And they cap out at 18 months. If the veteran is behind on utilities, then we want to make sure that, we find any any kind of fund source that will help them pay for utilities, then our CES office will make sure that they have access to that. And like I said, if the veteran can't come to us, then we make it a point to make sure that we go out and see the veteran and help them get the necessary documents that they need to apply. If they don't have a DD 214, then we call our local service officer, make sure that we can get a copy of it. So anything we can do to help them out, we will definitely do.
Any questions? Okay, let's move on to Walla Walla County.
Hello, everyone. Thank you for having me and thank you for your service. My name is Wendy Chang. I'm the Veterans Relief Fund Administrator in Walla Walla County. My office is located in the Walla Walla County Department of Community Health building, which is located at 314 West Main Street. And my contact number is 509-524-2936. So how do veterans access the fund? Our Veterans Relief Fund is similar to what Benton County has. Mainly there are 3 requirements. The discharge status, we require that a veteran has an honorable discharge and must have served on active duty for at least 180 days. Or the veteran could get a general under honorable discharge with a medical reason for separation, regardless of the number of days served. Members of the Armed Forces, Reserve, or National Guard are also eligible under certain conditions. And then the second requirement is the veteran's income level must be at or below 175% of the federal poverty guidelines, which in 2021, it's about $1,878 a month for one person in the household. And finally, the last requirement is residency in Walla Walla County for at least 60 days. However, there are exceptions to the residency requirement. And then what kind of help can we offer? We can help with rent. If the veteran is not already using a housing voucher, we can also help with bus passes, transportation costs, utilities, background check for work or housing, prescription assistance, dental care. It's a lifetime cap of $2,000 and is only available to the veteran, not for dependent family members. Also work-related expenses, we can, for example, we can help with auto repair up to $600 a year, license and registration fees, car insurance for a month, work clothes, work tools, gas voucher, etc. And also finally, we can also help with burial expenses up to $1,000 for the veteran. There is an annual cap of $1,200 a year for a veteran. However, there's an additional $200 for each qualifying dependent family member. That's all I have. Do we have any questions?
Anybody have any questions? Fine. Well, this is to everybody who's on the net at this time. We would greatly appreciate any recommendations or topics that you would like to hear. I'm sure that Lisa would just love to get an email from everyone with topics that we can discuss in these town hall meetings. It would be greatly appreciated. This wraps up the town hall meeting on behalf of the Governor's Advisory Board of Washington Department of Veterans Affairs. I would like to thank Linda Wandra and the 2 presenters from the counties, both Benton and Walla Walla, for their giving us the help that the veterans need in their communities. You please send any recommendations or comments that you have on the way your Governor Advisory Board And we can look at them, we can make suggestions, we can look at what we need as far as getting the information to you in the community. Once again, thank you very much.
I have a parting shot. It was several months ago that the individual who was supposed to organize this town hall dropped the ball. And Bob Wallace very generously stepped in to take it over. So thank you, Bob, for your efforts. Thank you, Lisa, for your efforts. And thank you, Gary Lott, for making this electronically all come together. Very wonderful presentations, a lot of information. I'll echo again Bob's comment. If any of you in the listening audience have recommendations of topics to cover in the future, please let us know. And thank you all for your attention. Thank you, presenters, for your time and trouble. And we hope this has been a useful hour plus of your time. Thank you.